if you look medical and scientific, military, homeland security is working very, very hard with all of them in order to vanquish the virus. As you know, every level of government, state, local, and federal, is working nonstop to obtain more personal protective equipment for frontline workers. We're delivering vast orders of this material. I'm going to ask a couple of the people here to join me that both make it and deliver it. Joining us today are the leaders of America's largest distributors of pharmaceuticals and medical equipment, including McKesson, Cardinal Health, Henry Schein, Owens and Minor, Medline, FedEx, and UPS. We just concluded a very productive meeting about ways to keep our supply chains and delivery systems moving at top speed. And maybe I'd like to just ask for a couple of minutes for Mike Kaufman to come up, and maybe Ed Pesicka. Mike is with Cardinal, and Ed is Owen and Minor. But I appreciate, and if anybody else has anything, please come up. But if you could come up, Mike, for a second, and Ed for a second, just you could maybe say what you told me before when we had the meeting. Thank you.
Thank you, Mr. President, and thanks for your leadership on this. Because of that leadership, we have really seen the government agencies working with industry like no time before. We've seen HHS, FEMA, the CDC work incredibly effectively with all of the distributors, and all of the distributors working together for the good of the people. And all of us have been so focused on making sure that we take care of our customers, because our customers are the ones that are taking care of the patients every day, and we need to do everything we can to make things good for them. And so it's been great to see how well all these government agencies have been coordinating together with us.
Thank you.
Thank you.
Appreciate it.
Thank you, Mr. President. Let me first start by thanking the administration for all the support you have provided to the industry. You know, one of the things we did hear the challenge, and starting in January, we've ramped up our production in the Americas, including our facility in North Carolina, where we are now manufacturing an additional 40 to 50 million masks per month to get into the U.S. healthcare system. And we talked a little bit about this in the pre-meeting. One of the issues we're struggling with is the demand increase. You know, used an anecdotal example of one hospital in New York that traditionally uses roughly 10 to 20,000 masks a week are now using 200 to 300,000 masks a week. So you multiply that times the entire U.S., let alone the same demand outside of the U.S. That's part of the issue we're running into, is even with a significant ramp up in supply, you know, there's still that demand that is much greater than that supply.
Thank you very much.